This patient was referred to me for endodontic treatment of tooth number 19. Tooth was prepped for a crown. As you can see, he had a deep cavity here approximating the pulp of the tooth, and afterwards patient started to have a lot of pain. We diagnosed the tooth as irreversible pulpitis with acute apical periodontitis, which basically means the tooth is extremely sensitive to cold, lingering pain, and also pain to chewing and biting. So we discussed options with the patient. Of course, the recommended treatment is endodontic therapy. That's a temporary crown on the tooth. These were 24 millimeter long roots, and I want you to pay attention to this right here. And here's the post-op. As you can see, everything went great. 4 canal systems. And you might think that, oh, that's the radiographic apex of the distal root. Nope, that's not the case. And I showed you that on the pre-op radiograph. This is the normal bone anatomy right here. Let me outline the radiographic apex of the distal root. That's what it is. This is not the radiographic apex of the distal root. Let me show you a different angulation. Now look at this angulation. You can see the roundness of this area here, of the bone here. And you can see that's the radiographic apex. This is just normal bone anatomy here, the roundness. Of the bone there. That's another angulation, and again you can see this is not part of the distal root. Distal root is right here. Distal root is superimposed on this region, on this area right here. And here another angulation. Again, you can see that's the outline of the distal root right here, not this. And this is again another angulation. You can see the outline of the distal root, and this is not part of the distal root. The distal root is superimposed on it, giving one the impression that this is the outline of the distal root, which is not.